Good evening. Welcome to the LSMS Virtual Roadshow and our membership meeting. As many of us, LSMS has had to adapt to the challenges presented before us with the onset of COVID. And I can say now, more than ever, I am so proud of my profession for our resilience and our resolve to practice good medicine with the challenges before us, and also our ability to work together to overcome this pandemic and the difficulties we've had to meet. I also want to extend our thoughts and prayers to our peers and our friends in Lake Charles. We are thinking of you, and we are here for you if you need us. I'm excited to have this opportunity for us to discuss the challenges that we still face and to work together, presenting ideas on how we can move forward and improve the practice of medicine in our state and help our patients. With that said, I'd like to share with you a video that we put together, and I hope you enjoy it. Thank you.
We know that you're more than a physician. You're a mom, a teacher, a dad, an outdoorsman, a fitness enthusiast, a friend, and so much more. That's why the Louisiana State Medical Society is proud to offer you more than a membership. Through advocacy, collaboration, education, and communication, we ensure that your ability to provide unparalleled care to patients across the state is maintained and supported. Experience a membership that is centered around you. Experience a membership with the LSMS.
Our next panelist is Dr. Jimmy Guidry. I want to thank Dr. Guidry for joining us. He is our state health officer here in Louisiana. He's also the medical director of the Department of Health, and I'm sure you've all seen him all over the news and participating, and his name is on everything right now. I understand he's been over managing some of the emergency efforts in the parishes that have been impacted. He's here tonight to give us an update on both COVID, and if he wishes to share about hurricane efforts, he can do that too. So Dr. Guidry, thank you so much for joining us.
Thank you for inviting me to be on this. I had a few slides I wanted to show on statistics. I don't know if we have those. I wanted to show a little bit about COVID before I talked about anything to do with the hurricane. There are a lot of statistics on what's going on with this virus. And the one that I pay particular attention to are available hospital beds for a number of reasons. It kind of tells me how many folks are getting so sick with coronavirus that they're ending up being hospitalized. And of course, it also has to be balanced with the beds that are being used for other purposes. So when you look at this and you see that, you know, COVID doesn't necessarily take up a lot of beds, but it adds to the beds that are already being taken. So there's a lot of load balancing, if you will, that hospitals are doing with a lot of input from medical professionals, obviously, to make sure that they're not doing more procedures that people would end up in a hospital and not have the available beds. And in Baton Rouge, the past few weeks, we've been having between 3 and 6 available ICU beds, which really gets close to where we get in trouble. Of course, the issue with the beds is not just the beds that are available. It has to do more with the staff that are available to staff those beds. So I'd like to go to the next slide. And what I wanted to show on this slide, this is a number of COVID patients in hospitals. And the reason this gets my attention is when you look at the first peak, which was in March or so, in April, we were at 1,900 beds for COVID. And so when you look at the fact that we hit that first peak, and then after we started staying at home, you can see where it goes to the valley when we're hitting 400 or 500 beds a day in the hospital. And when you get to that valley, right about the time, right 2 weeks after Memorial Day, then we start having more and more patients ending up in the hospital with COVID. And right now, you can see that the second peak's not as high and has started coming down, but it's not anywhere near the valley that we were in. And the reason this gets my attention is we're starting school. We have Labor Day right around the corner. We have people now that have been displaced around the state. So the chances of exposure, the risk of exposure is going to go up. Because of that risk, because we haven't gone down to the valley we saw at stay at home, we may see another peak, which will be higher as we go into flu season. And that certainly gets all of our attention, because if we're already looking at beds and we're in the summer, imagine what it's going to be like in the fall and into the winter if this virus continues to do what it does. So we're spending a lot of time explaining to people that they have to wear masks, social distancing. The critical part of trying to slow down the transmission of this virus, hopefully getting a vaccine soon, but not soon enough, obviously. And what's going to happen now that we have all these other factors that are playing. Tomorrow, there's a hearing at the Capitol on contact sports. People want to have football coming back. They want to have soccer coming back. And of course, the kids tend, for the most part, tend to handle this virus, but it's their ability to take that exposure and bring it home and share with their grandparents and folks that are immune compromised that really gets our attention. But now that they've come back to school and they want to do all these activities, the question is, what is that going to do to our exposure rate? And what is that going to do to the number of folks ending up in the hospital with this virus? So I want to share those thoughts with you, because as we go forward, I mean, it's amazing the battles and the discussions that occur on a daily basis in trying to get people to do things that prevent this virus from spreading. The place that it spreads the quickest is in a congregate setting, specifically in a nursing home. And we pretty much eliminated visits, nursing home visits. And there's all kind of pressure to allow people to go back into nursing homes and visit their family members. I mean, I get some real nasty letters about how their parents and grandparents are in prison, and how dare we keep them from seeing them. And of course, they're allowed to go see them at the door, at the window, but they can't go in the place because of this, how rapidly this virus spreads when it gets in the nursing home. What has been used in other states is outdoor visitation, and with masks, with PPE, with distancing. When you get to about 5% positivity rate in your testing. In Louisiana right now, there's only about 21 parishes out of the 64 that are at 5% or below. Everyone else is considerably above the 5%. So in those 21 parishes, we're going to discuss tomorrow whether we should start opening up some visitation. Of course, very guarded in that. And if you started in those parishes that have 5%, what other parishes, other places are going to say when they see that, hey, how come they can visit their loved ones, but we can't? So a lot of discussions, a lot of anxiety around this, but it really is to keep this vulnerable population protected from this virus, because when it gets in there, I was reading an article today in Germany, very similar experience. When they get a case in a nursing home, it usually ends up with 19 positives and a few deaths. So literally, we know that as people start visiting and as the virus is spread more and more among school children, college kids, that there's going to be a higher risk for this getting into the nursing homes, and therefore higher numbers of those folks ended up in the hospital. So I wanted to share that kind of some thinking around what we've been seeing and what we think we're going to see in the near future. And it is alarming that we've seen these two peaks, and that we could actually have a higher peak if we don't practice all the things that we're pushing, which is as you know, wearing the mask, keeping a distance, and making sure people are not spreading this virus. Next slide. This is more about ICU beds. Of course, when you look at ICU beds, there's not large numbers, but certainly when you look at availability, that's where it gets your attention. And so we know that when you start doing procedures that someone may end up in ICU, that we have to be careful with that, especially if the COVID in the community is going up, and more so about taking up beds that might be needed, for waiting for this, for a vaccine. So in the news, what you've been hearing is that they hope to have a vaccine sometime in October. Of course, Dr. Fauci says it'll be more like November or December. So it depends on who's telling you as to when they'll be ready. We are preparing for receiving the vaccine and distributing vaccine and coming up with who needs to get it, because obviously it'll be in short supply. So initially, so you'll have to be very selective in who gets it. So we're hoping to have it, as soon as October, maybe November, but probably start hitting those folks that need to get the protection. And usually it's usually around medical professionals that are at high risk because they work with this, certainly nursing home population. And so it'll depend on the number of doses as to how we start deciding who gets the vaccine. And then it's going to depend on who wants to take the vaccine. Obviously, people may not want to take it, and because of the fear that it hasn't gone through and completed all the trials yet. So literally hoping for a good vaccine to help get this virus under control so we can get back to some normality. But I certainly hope that the vaccine that comes gives protection. I don't think we know at this point how long it'll give you protection. So there are some unknown questions on the vaccine, and you'll probably have to have two shots, maybe a month apart is what's being talked about. So that more to come on that, and hopefully that's going to help us get this virus under control. So I'm seeing another question. Am I concerned about the safety profile? And I'd have to say that the scientists are telling us they're doing all the things quicker, but they're still going through the trials. But we all know that most vaccines take months and years to develop. This one's on the fast track, and there's a lot of companies doing it. So I'm hoping it's safe, and I'm hoping that they've tested in enough people to figure that out. But I don't know the answer to that. I really don't know that the scientists at this point can convince us that there's been enough time to get those answers. So it was sped up and it was tested in humans, but whether there's a safety factor here is a question that we should all be asking ourselves as we guide our patients to whether they should get the vaccine or not. So with that, those are only 3 slides I think that I sent. I thought at this point I would share a few highlights from the disaster. I don't want to take up too much of our time, but some of the things we're working on. And so far there are 20 reported and validated storm deaths, which is, 1 is too many, but certainly 20 is not near what we thought we would see with the devastation of a storm like this. And these deaths really haven't been related to the storm. Usually storms will get you because of the water and drowning. This storm seems to be getting people with post-storm events. Half of these have died from carbon monoxide poisoning from having their generator either near a vent at their home or next to a window or inside their home. And they don't realize those risks. So we put out a lot of information out to folks to tell them if they have a generator, how to do that safely, because that has actually killed half of the people that have died from this storm. With that said, some of the other things that we've seen is like healthcare facility evacuations. At this point, there are 11 hospitals that remain evacuated. which is 5 less than there were earlier this morning. So they're coming back on, in some places. There are 8 nursing homes that remain evacuated. There are 9 hospitals that are on generators, and there's 7 nursing homes that are still on generators. So when you look at this, there's a lot of in the response that we're still working with and still dealing with, and folks are going to be struggling to come back and to that, especially Southwest Louisiana, and trying to get their life back on track. We have some patients. We've opened a medical special needs shelter that we've opened up, and with a contractor to take care of folks that can't stay in hotel rooms. The majority of our evacuees are in hotel rooms because we wanted to do non-congregate sheltering. So we're trying to do hurricane sheltering in a COVID environment. So literally have some 9,000 people in this state that are in hotels, and almost 10,000 in Texas that are in hotels. So a lot of folks that have been displaced, still folks coming out of their homes because it's been a week and they don't have power, they don't have air, and they're realizing it's not going to be anytime soon that they're going to be able to stay in their homes or repair their homes. So we still have folks that are coming out of the area to be sheltered. Today we actually had a planning meeting. What if one of these storms coming off the coast of Africa decides it's going to make it to Louisiana? Everybody says, it's 2020. Who knows what's going to happen this year? So we got a plan for if there's a storm that comes in New Orleans, where most of our evacuees are, we're going to have to evacuate New Orleans and the folks in the hotel. So a lot of planning around that. So there's no rest for the weary here as we try to figure out how to deal with responding and being prepared for what might happen this hurricane season. So I'll stop there. There's just a lot going on. And I just wanted to share some of these things with you, and I'm certainly open to questions. But we all have plenty on our plate. I do know, I looked, some at the survey, and I realized that a lot of patients still afraid to come to your practices to be seen because they might get COVID. That has improved, but it certainly hasn't gotten back to normal. And it may take a while for people to feel comfortable. They do seem ready to get back to sports quicker than they're ready to get back to their medical homes. But for the most part, I think we've done a lot of things to try to address this virus. And we learned by holding off on procedures, elective procedures, just delayed them till summer, which might have helped from the standpoint of having beds available. But it also put some people at risk because their medical procedures postponed, probably put them at higher medical risk. And we're hoping as we get through this next wave that we're not going to have to go back to stay at home to get it under control, go back to shutting down elective procedures. But I do know some of the hospitals right now are definitely slowing the roll of their elective procedures so that they can allow to have the beds they need to take care of the patients. So that said, I think I'll go ahead and take a rest here and see if there are any other questions.
All right, Dr. Guidry, thank you so much for being with us tonight. And, I, as a physician member in Louisiana, really appreciate the strong tone taken by the governor's office and the Department of Health. We think we've had great guidance and support from you. Really appreciate that. One of the questions that came through from our chat box, Dr. Aaron Sebia, one of our very active members of the Council on Legislation, asking about dialysis patients and other high-risk populations. In the nursing home, this has been a major concern, most times as a carrier of COVID. Any thoughts about mandating higher frequency of testing for them, especially dialysis patients in and out of the nursing home?
So at this point in time, we were having the nursing homes test their patients every week. Of course, the storm kind of slowed some of this, and some nursing homes had to evacuate. But anyway, we were doing weekly on the negatives to continue to check for them. And then CDC has come out with guidance, and CMS, that if they, in an area where they're a higher level of positivity, over 10%, that you should do it twice weekly. And we certainly haven't gotten to twice weekly, but what the feds have done, they're now pushing out the antigen tests to the nursing homes so that they can have a rapid test. Our concern about that is if it's a positive with the antigen test, you know it's positive. If it's a negative, you may have to follow up with a PCR test. If the patient looks like they could be COVID and they have a negative antigen test, you may have to do the PCR, because the antigen test is reliable when it's positive, but may not be reliable when it's negative. So we are going to be testing more at the nursing homes. They will be. They'll have their own testing, and it'll be rapid testing. And then we'll have to decide, are there enough test kits, and is the test reliable enough that they're going to have to test visitors once we open up visitation? Because everybody coming there and everybody leaving there to go get a procedure and come back, dialysis, will have to be tested to make sure that they not bringing it into the nursing home.
Okay, thank you. And I had a question myself, but sort of a comment and a question is, you know, really appreciate the support from the Department of Health for telemedicine. And, you know, out of a crisis, sometimes good things happen. And, you know, from some of our perspective, the kind of growth of telemedicine and the emergence of telemedicine may be something good that comes out of this crisis. Where do you see telemedicine sort of ending up after this? Do you think it's something that will continue at a heightened level because of the crisis? And what do you think the benefits are to the patients in Louisiana?
So that one's a good question, because, you know, certainly patients liked it. They liked the convenience, and they liked the fact that they didn't have to come in and put themselves at risk. But as we've gotten further away from, you know, that concern and that worry, I'm finding a transition back to some face-to-face. It seems like people prefer face-to-face. So in talking to providers, they've told me they had a lot of uptake on that telemedicine for several weeks with all the fear. And now as people come back, they're wanting to be seen. So the numbers are going down from what I've been told. And so I do think there's a place for it, but I do think it's going to be hard to replace face-to-face when people want to come in. But I do think it has a purpose, and it's certainly more encouraging than we ever had before. But I'm not sure. It'll depend on probably the age of the individual, because the younger people like it. It's quick, and the older people still like to come in and see folks. So I guess it'll change over time.
And I will say that in the survey that we conducted jointly with the Louisiana State Board of Medical Examiners, we did do a component section of it that was on telemedicine. And we are, towards the end of the meeting, going to share those statistics that we were able to pull out thus far from that section as well. So there's some good information in there.
All right. Are there any other questions from the members on the webinar? All right. Well, if not, oh, we got one more coming through. Let's see.
I'm sorry, I'm getting text messages, which could mean somebody's having difficulty, so I'll check those too.
So sort of a follow-up question came through from one of our members on the webinar. Will the favorable reimbursement for telemedicine continue? So sort of a follow-up question on that one.
That's an unknown. I'd like to say yes, but I think there are things we're paying for now for COVID and this COVID environment that I guess the federal government will have to decide whether they'll continue to reimburse at this rate. So I think a lot of that was done quickly. And so I really don't know if it'll stay at this rate or if it'll actually go down. And that'll depend, I guess, on federal funding.
All right, well, we'll mark you down as a supporter and appreciate that. But wait, we got
There
one more.
one
Okay,
last.
we got one more popping up here. All right, popular guest with us, Dr. Guidry. What is your feelings about flying commercially at this time? Would you risk it? If you're comfortable answering that.
So the way I feel about the whole COVID environment is that if you wear a mask and you can keep your distance, the risk is not that high. You know, if you're 6 feet away, if they're putting you sitting in a seat next to someone that you don't know, that's 1 foot away or less, not safe. So it really depends on the seating. And we had to take this into consideration with our evacuation, because we had put folks on a bus and we had to skip seats so we wouldn't have them sitting next to each other. Now, if they're family members and in the same home, not that important. But if they're strangers, very important to have the mask on and keep your distance. So I think it's safe depending on the airline and their rules.
Yeah, I think that's good advice, and hopefully something that all of our members can follow, and all our patients in Louisiana. So thank you so much for being with us tonight, Dr. Guidry. Greatly appreciate your time and everything that you've done for our patients.
Thank you. Thank you for having me.
All right, next up, we're going to have a couple of health committee chairs with us on the webinar. First, I'll introduce Representative Larry Bagley. Representative Bagley served Louisiana for 44 years as an educator. He was a coach and assistant principal before serving in the House of Representatives. He's on his second term now, currently as chair of House Health and Welfare. Thank you, Representative Bagley. In addition, we have Senator Fred Mills. Fred Mills, longtime legislator and friend of physicians here in Baton Rouge. Senator Mills serves as chair of Senate Health and Welfare, and near and dear to my heart, was very supportive of some of our opioid legislation a few years back, especially the expansion of the prescription monitoring program and other efforts. So thank you all very much both for being with us tonight. And I'll turn it over to Representative Bagley.
Well, the only thing I'd say is I appreciate it. I had a little trouble getting on. I've been trying to close. But
You made it. You made it in time.
well, I had a constituent that talked right up to the end, and he would not let me on the phone. So it was my fault. I could have hung up on him. But anyway, that's behind me. And I'm not a doctor. I've learned most everything I know from Senator Mills. He kind of keeps me under his wing and teaches me what I need to do as far as that. He's got much more experience. But I did have 4 years prior on the committee. This has been certainly unlike anything in my life. There's nothing to even compare it to, this whole thing. My life now is hard to commit to because basically I'm isolated even now because I'm not married and I'm not dating. So I come home, I'm home here alone tonight. My family comes by sometimes, but not very often. My grandson went to LSU and immediately caught COVID. So I've been taking him food to his room when I'm down there. So, you know, it's a learning experience for me. I appreciate the ability to have top doctors speak and me to speak to doctors. I have had many conversations with Dr. Golly in Shreveport Chancellor Med School. He and I have talked many times. In fact, we had a conversation just the other day. You know, Again, I don't have enough background to speak with any authority other than what I've learned on this committee. So I would certainly like to defer to Senator Mills, who is much more knowledgeable about all this and can help me.
All right, thank you. All right, Senator Mills, any opening comments?
Yes, it's so good to be with y'all. And I guess the first opening comment I'd like to make is to thank all of the physicians. That you guys are truly heroes, and for what you've done and the frontline work you're doing, it's absolutely remarkable. So on behalf of all the legislators, I'd like to thank y'all. And you know, it's just amazing what you did. Kind of on a funny note, before we get started, I was listening to Dr. Guidry. And Dr. Guidry and I grew up across the street from each other. We both from Breaux Bridge. And, you know, my dad would always see, because we lived right across the street, my dad would always say, you need to be studying more like Jimmy. Jimmy's going to end up to be something. And I started thinking when I was listening, I said, yeah, my dad was right. Jimmy's a doctor and I'm a politician. My dad was 100% right. But I guess to take just a step back, y'all, and I want to thank Chairman Bagley for all that he's done. And he passed some really tough legislation this year on medical marijuana to allow more opportunities for more physicians and more patients to be involved. So I want to thank him for that. But if you look back on this past session, imagine we had 1,389 bills that were introduced, and many of the pieces of legislation were extremely important, but many legislators said, you know what, we'll do it at another time and we'll work on it. Only 370 bills were signed into law. Usually there's about 800 bills that are passed during a regular session. And I want to just take a real stroll down memory lane, because so many times I've worked with the Medical Society and the great work you do is really fabulous. But think back this session. We didn't have to have a Practice Act battle. So that's good news. We're trying to find some good news. We didn't have to have a cosmetic surgeon fussing against a plastic surgeon to see who can advertise and who can't advertise. So if you look back this session, I think from all of the issues we've had to battle and face together, I think right now what we should be looking at is moving forward. And I want to tell you, I was just on a conference call today on telemedicine throughout the United States with folks. And one thing that was brought to that I think we should look at is payment parity as far as when telemedicine is delivered. Other states are looking into that issue of payment parity. We should also look at, from what telemedicine has generated, do we need to look at tweaking some legislation? Do we need to work with the Board of Medical Examiners from a regulatory standpoint, licensing standpoint? So I know on behalf of Chairman Bagley and myself, we'd like to work on those issues with you. I want to tell you, and I'll conclude on this, the Senate Health and Welfare Committee and the House Health and Welfare Committee really deferred many pieces of legislation that we thought were not timely and we could work on. So I think there's probably some pent-up demand legislatively to work on. And we want to offer our services to work with the medical society on that. And we also want to work with you if there's some regulatory issues that need to be brought to forefront to work with either the Board of Pharmacy, the Board of Medical Examiners, anybody there. Because as you know, many times we're working on legislative issues that we could work on with the different boards. And on that note, I guess I'll just conclude that my history personally of being with the Medical Society, I really enjoy working with you. I was working with y'all in the 90s with Kerry Cooley and Sharon Knight on collaborative practice issues. So my history with you goes long and far, and I'd like to continue to be involved. And I can tell you on behalf of the committees, the health and welfare committees on both sides, you're always welcome, and we always want to try and work on issues that are very important for you. And I'll just conclude once again to tell you all thank you. We're so proud of the work you've done throughout the state, especially with COVID-19 and always. So a big pat on the back to all of y'all.
All right, well, thank you very much. Well, we'll go ahead and kick it off with, this is a fairly meaty question. It seems to be directed towards you, Senator Mills. It says, Freddie, can you comment on the future of out-of-network and balance billing legislation after the bills died this past session from one of our physician members?
I know when I was on health and welfare a few years back and balance billing was a big issue, our health and welfare committee deferred it. We didn't think it was ready for prime time. We did not want to we wanted to make sure that no providers or hospitals were hurt in this whole battle. I will tell you, I guess from behind the scenes, what I've seen, it looks like there are so many different factions that they cannot get on the same page. I think, and I believe that the Medical Society, the Hospital Association, and the EMT folks, I think if you can't all come together, you have the power to either block it or make it happen. And I wouldn't give that power up under any circumstances at all. I would keep that power. I just don't know if you and your members realize how powerful you are when you mobilize in unity. And I think that as far as balance building, I think you should control that show.
Yeah, no, that's a good point. I mean, we were able to get some consensus this past session with the hospitals and other providers, and but still didn't quite get it done. But hopefully next time. So, all right, this next question is directed at both of you, and so maybe we'll let Representative Bagley answer it first. What is the best way for physicians to contact their legislators to weigh in on bills during session with the current COVID restrictions on visiting the Capitol? Is it email? Is it phone? Through the LSMS lobbying staff? Representative Bagley, any particular advice on how physician advocates could be most effective during a COVID era?
Yes, for me, I get, as I'm sure Senator Mills and all the legislators get tons of emails every day. And for me, I'd always appreciate more getting a phone call or text, because I'm going to see them there in my pocket. When I'm on the floor, I feel it buzz. And I do answer it immediately. Or my assistant, if they call my office for me and they identify themselves, I need to speak to Representative Bagley about this issue, and I'm Dr. So-and-so, I'm going to step out and call them back right then. So I take that pretty seriously about returning calls. I try to turn emails. The problem is there's so many. Sometimes I don't, I'll get 30 that don't need an answer in one. So I try to find all of them. So actually for me, I can't speak for anybody else. For me, the phone is the best, and my number is on my Facebook You can, my personal cell phone is, my legislative site is only, you can look at that on the internet for my website. So I'm pretty easy to get a hold of, and if you call, I will certainly call you back or talk to you immediately.
Yeah, thank you very much.
And I just want to point out, we really did destroy email with Representative Bagley, the Health and Welfare Committee, over the one bill that was a scope of practice bill with the APRNs this past session, because we had no other way to do anything. So we unleashed email, and I think every single legislator on health and welfare probably got over 700 emails from physicians out there. It was finally like, if like some of the ones that you'll hear from later, please stop, we know, but.
And I will tell you this, which you should think about is, I think we're all getting used to these Zoom calls. So I think the Medical Society does a great job of doing a tour right before the session to tell us what issues are important. What I would really highly recommend, and I think a lot of organizations are doing it, is these maybe group Zoom calls with select members regionally where we can all get together and really talk the issue through. And I totally support what Representative Bagley said about the phone calls, but I really think we're all getting comfortable with the Zoom calls, having them in our office. So maybe right before the session, for whatever your agenda is or whatever issues that you really are passionate about, I think maybe some Zoom calls in groups would be really, really beneficial. Because what happens to us is if we know before session what issues are important for you and what issues you may be opposing, sometimes maybe we can work those through before we get into session.
Yeah, thank you very much. We've written that down, and we're going to take you up on it. So we'll be calling you to get that on your calendar soon. Let's see. It looks like we have another question from one of our physician members. It says, if a physician accepts payments from the VA, Medicaid, or Medicare, can they still recommend medical marijuana? I heard that at a behavioral health conference that a physician who accepts these payments cannot recommend them. Any thoughts on that?
Well, I know what the law that we passed, that I brought, and the law said that if you are in good standing with the Board of Louisiana Medical Directors, that you can you can't prescribe it obviously, but you can recommend it. I never have heard anything about Medicare, Medicaid, but I know the law said, that's what the law said when it passed. So I would think that any doctor that was medically viable to practice medicine, and that was the whole reason, could recommend medical marijuana. I would think maybe a lawyer needs to answer that question. If I'd have known it was coming, I'd have asked my attorney in my office to give me an answer, but I didn't.
All right, we'll go with that one for now. Senator Mills, go ahead.
Yeah, let us research that a little bit, because the way the bill was originally passed, we put some provisions in there that as long as it was still a Schedule I drug on the federal side, there were some certain state issues that we were able to work with the Board of Medical Examiners, but there still is DEA issues, federal issues. So our Senate staff is on the phone hearing this. So we will do a little bit more research, and we'll get right back to the Medical Society and get you something, because there's always some type of federal restriction. It could be a loophole that we wouldn't want to hurt anybody. So let us find that out for you.
It's been brought up more than once, and so I will reach back out to Christine as well and see if I can't share some of what we've been hearing offline as well.
Yeah, because when we did the original bill, there were some trapdoors with the DEA Schedule I federal issue. So let us do some homework on that.
All right, and then it looks like we're bumping up against our time schedule, so we'll make this as the last question. I hear rumblings of a special session in October. Will this happen? What will be on the call? All right,
I guess I'll.
Good. Representative Bagley, you want to take that one first?
I'll go ahead and let Senator Mills go first. He's closer. I'm in Shreveport. He's closer to the
Well, I will tell you, I knew that question was going to come up, so I called the Senate president just 2 days ago, and he said it still appears that there will be some issues with federal monies hopefully coming down here in October, that we will need to get together for that. I did call the governor, and I talked to the governor about this, and I said, Governor, we need to get together as medical professionals, which I will challenge the society to think about it. And we probably need to see what lessons we've learned since March, since COVID-19. And if there's anything we need to tweak legislatively, we need to have the call pretty open to do that, especially if there is going to be certain mass immunization issues. Maybe we need to do some more protection for you guys liability-wise with COVID-19. So I would challenge us, our office will be happy to work with you, but the governor was open to it, the Senate president was open to it, to maybe have a broader call if we need to get deeper into healthcare issues. So let's challenge ourselves to think about it in anticipation of an October session. But I think we're gonna be talking for sure about budgetary issues, but let's keep it open if we need to talk about issues that are important for you that we need to maybe correct, modify, or give you some limited liability protections.
Thank you.
All right, good answer. All right, gentlemen, thank you all so much for being with us. Your time tonight, we greatly appreciate it. The members appreciate it, and we look forward to working with you going forward.
Thank you very
Y'all
much.
keep up the great
Enjoy
work.
it.
Thank you.
And look, while we're transitioning out, you two should feel free to stick around and listen and poke in if you feel the urge to. This next group is going to be, I think this is going to be fun. We went a little different route. I know that so many of you have already read our legislative recap and update. So what I did was I reached out to a group of new and newish legislators, and we're going to put them all on the screen at the same time, and we're going to let them just bounce back and forth with a number of different things that they may want to talk about. I may ask some questions here and there and try to guide them down some different paths. And I'm going to do this in alphabetical order. I don't know how all they're going to show on your screen, so you just have to hang with me as we go. But we have Representative Amy Freeman. She is from New Orleans. She is newly elected, District 98. She is a Democrat. Representative Jeremy Lacombe, he is from the New Roads, Livonia area over in Point Capee Parish, District number 18, and he is also a Democrat. Representative Bob Owen, I think he just appeared down there as well. He is in St. Tammany Parish, Slidell area, Republican, House District 76. We have Representative Thomas Presley. He's my North Louisiana holdout since I'm from the other side of the state. Caddo Parish, the Shreveport area, Republican in District 6. And then we have Representative Larry Selders, who he is
I didn't know I was going to be on it.
He is District number 67, and he is a Democrat. And the reason that I think this panel is so much fun is because they are all related to physicians. And so I think that hearing from them and from their perspective, who they get their advice from, they've grown up in medicine or married into medicine. And so I would like to think that their physician advice is really, really good. So with that, we have all of your mics open. You can bounce back and forth. I know some of you are on health and welfare and got to experience our onslaught of emails. I think it was, it's very hard for me not to use your first name, so I apologize if that slips out and I failed to call you Representative Presley, but it was absolutely Representative Presley who told me stop it. I know which way to go. And I think it was Representative Selders who said, I know whose house I go home tonight, leave me alone. It's been a great lot of fun getting to know each of you. I look forward to getting to actually visit with you in person soon. With that, whichever one of you wants to take away the reins, please feel free to share with us what you want. Ladies first then.
Oh, you want me to go first? Okay, that's fine. I don't know if we do alphabetically and we go by Adato, which is my maiden name, then put me in the first spot, I guess. So, no, I appreciate being part of this, and it's good to see Dr. Broussard on this call because I think you live in my district, right? I know we've met before and connected because you're at Ochsner. So, my father is a retired physician. My grandfather was a physician. I have a great aunt who, if she was alive, I think she'd be 102, but she was a health officer for the state of Louisiana and went to med school at a time period where she was probably one of 2 women in her med school class. So I'm not a physician, but I've always been around them. And my family, I have a lot of family members who are nurses actually and work in healthcare as well. So I appreciate all the work that the doctors have done, especially in this crisis, and y'all are on the front lines dealing with really tough decisions. And as a freshman legislator, it has been helpful. I know there was one question that, y'all were asking how to get in touch with people. I also like it when, people call my office, like Chairman Bagley said, or call my cell phone if they have it, because then it's easier for me sometimes to understand some of the issues you all are facing. I know when we were dealing with the balanced billing issue, even though I'm a business person by trade, I don't understand that day by day that some of your offices and some of the things you're dealing with. So and the emails are helpful, but it's true when you get 35 emails, it's different to actually have a conversation with somebody about their perspective who can brief you and educate you on that. And so thank you for everything y'all are doing. I mean, I'm accessible either through email and my office as needed. I'm happy to answer questions. I don't know how you're handling that, Dr. Broussard, if you're going to take some and pass them around. But
yeah, thank you. We'll continue with opening remarks, and then we'll probably get some questions through the chat box. But excellent, thank you very much. So we'll stay the alphabetical order. Representative Lacombe.
I want to take a minute. I have my wife with me sitting here next to me, Dr. Jessica Lacombe, who's a attending physician at Our Lady of the Lake Hospital. She works for LSU. And she's sort of my go-to on medical issues and whatnot. In addition to that, basically her 15 classmates from medical school or the other 15 people from her residency are constantly bombarding me with the issues of the day that doctors are facing. In regards to this past session, I'm a lawyer by trade, but I'm in no position to answer the question previously that they were saying. But 20 years ago, I founded a cancer charity as well. So I'm a director of a nonprofit cancer charity here in Point Covey Parish that we work exclusively with providing unmet medical needs to indigent patients and people who need it. So for the past 2 decades, prior to running for office, I've also been involved with the home health and hospices and hospitals here in New Roads. That sort of work in the cancer community led me to sponsoring a bill last year. It was became Act 147, which dealt with the laxing of the criminal restraints for possession of marijuana on LDH hospitals, on LDH licensed facilities. In addition to that, we also co-sponsored a bill that became Act 2222, which provided insurance coverage for clinical phase 1 trials for cancer patients. And I worked with Dr. Mark Mantrada, who's the Director of Precision Cancer Therapies at Ochsner in New Orleans, to get those bills passed. When it comes to getting in touch with your legislators, I get it. I know Larry's married to a doctor, Thomas's, family's doctors, Amy's dad, and all of them are doctors, but there's nothing quite like having physicians in the legislature. And I would encourage this society and this group to get out there and encourage physicians, it doesn't matter if it's Democrats or Republicans, to run for the legislature. We have 0 doctors in the Louisiana legislature, 0. And when it comes to those healthcare issues that are coming up and all the policies, and whether it be balanced billing issues, scope of practice issues, all of those things, you don't have a voice in the Louisiana legislature, not one physician there. That is sort of not always the way it's been. There's always been at least 1 or 2 physicians there. And I see that as one of the big issues that LSMS has to tackle going forward. We have to encourage more doctors and physicians to get involved and run for office. Do I? Yeah. So my wife's chirping in my ear right here saying, yeah, we know, that's right. Or just, yeah. So at the end of the day, Maria and the group, y'all do a wonderful job of getting it out there. And I see that in the last 2 or 3 years, the doctors have mobilized better as far as trying to get their advocacy issues in front of the legislature. There's other groups, other physicians groups that have come on into that to help get involved there. And, when you all come together as a group, y'all make a very powerful medical lobbying body that most of the other legislators have to pay attention to, but it would be really good at some point in the next 2, 3, 4, 5 years or whatever, getting at least 1, 2, 3 doctors elected. It doesn't matter party affiliation. We have to understand your issues. You need somebody on the floor there championing your issue behind the scenes and on the other side of the rail.
We've been working on a program to try and encourage physicians to run for office. We had some that did actually put themselves out there this last election cycle. They did not win, but we are trying to encourage that. So I appreciate that thought process.
It is, it's that, and then in addition, like with LSMS, my wife and I were just talking yesterday about, like, the Bar Association has the young lawyers section of the bar. I think LSMS has to do that as well with trying to encourage the younger residents and some of those people to get involved early on while they're in residency or working their way through, to sort of understand that all of these decisions that happen at the legislature have effects on your practice, and trying to encourage, I guess, either the next generation of folks coming in to be involved with your society, but also to be involved at the political level, at the state level, so that y'all issues are not falling on deaf ears.
Thank you. Representative Owen would be next.
All right, can you hear me, everybody?
Yep, we hear you well.
All right, great. Hey, everybody, my name is Bob Owen. I represent District 76. It basically encompasses Slidell from the Mississippi border to the Twin Spans of Lake Pontchartrain. This has been an amazing experience. This is my first term. However, because of COVID, our first session was kind of like drinking from the fire hose while being dragged over a bed of coals at the same time. It was, and after the regular session ended, honestly, we kind of felt defeated. We didn't get, some of the big bills, not necessarily related to medicine, but like tort reform, and the budget was not satisfactory in my opinion. But when we left the Capitol after the special session, I felt like we did what we promised to do, knowing that a like-minded House and Senate, we called our own unprecedented special session. We worked the tort reform bills, budget bills, and we got almost everything we wanted out of our legislative process. Personally, myself, I come from a medical family, 5 generations. My great-great-grandfather was the second Surgeon General of Louisiana. And I've had basically 5 generations of physicians in my family. My brother is, my father's a physician. My brother is a nephrologist. He teaches over, and he teaches at University of New Mexico and is a transplant physician over there. Lots of doctors in my family. I grew up in the world. I've seen medicine change over the past, almost 40 years now. And I'm in the medical business too. I have we have 2 medical businesses. One is a product business. The other is a clinic business. And so, I'm well aware of all the boundaries and barriers that physicians face on a daily basis. I am on the Health and Welfare Committee, which I did request, which was great. And it's, we've gotten a lot of good stuff done. I'm also the one I didn't request was labor, but occasionally we do have some medical related bills that come up in that committee. So feel free to reach out to me anytime. If you do email, make sure you let them know that you are a physician, and I will get back with you. But if you can reach out to me by phone, that's always the best way to get in touch with me. Text is another great way. I'm also on the speaker. Recently appointed me to the Louisiana Drug Policy Board. I am the House representative for that. So that is basically drug and alcohol abuse policy in the state. So I will be serving on that committee. We meet 4 times a year. So that'll be coming up shortly. So if you have anybody who has any concerns or anything about that, feel free to reach out. We had a few bills come up in the session. The one that I was really pushing that was Louisiana Right to Shop bill. It basically would have allowed people to see what their bills were going to be with insurance before they actually had a procedure done, and the procedures were going to be very limited. It was basically radiology and outpatient labs. So, but there was some confusion as to whether or not if somebody had an X-ray machine in their office, if that was going to be an issue or something like that, which it wouldn't have been, but we just didn't have time to work it out with everybody. So I'm going to bring it up again down the road, but with everybody together on board. And so we'll get that passed eventually. And that's the first step to transparency. Next thing was, surprise billing, which at first I was kind of with, but I really was, have kind of gotten away from. It's the way that it keeps getting changed is not fantastic. We knocked down expansion of nurse practitioner autonomy, which was good. And then, in the future, I just actually, sorry about that. In the future, I actually had a discussion with the American Kidney Fund yesterday about setting up some kind of task force, because we always have issues with kidney issues in the state. Nephrology is obviously something my brother's concerned with, and he used to teach LSU, so I think we can probably put a decent board together. And then in doctors' offices, in our office too, PBMs prior authorizations drive us absolutely crazy. We spend hours and hours every day doing those. I am dedicated to doing something about prior authorizations in the state and getting those knocked down. So that's a big concern of mine. And anything else, if you ever need to reach out to me about anything, I do understand, the day-to-day of the business of medicine. So, please feel free to reach out to me. I'm always available.
Representative Presley.
Yeah, thanks so much for having us tonight. I just want to start off by saying thank you to all of our physicians and all medical providers generally for all the extraordinary work that you've done over the last year. 2020 has been a year for all of our record books, from COVID to the hurricane and the effects of the hurricane going all the way up to the northern border of our state. It's a astronomical challenge, and y'all have risen to the challenge, and we truly appreciate it on behalf of those people in District 6. I am a son of a physician. My dad's a rheumatologist here in Shreveport, and that's actually what brought us to Louisiana. I was a small child when we moved here, but I've called it home and love it, and I'm glad to have the opportunity to serve the people of Louisiana and the people of District 6 up in Shreveport-Bossier. Bob kind of hit the high points on legislation, but I do want to point out that I expect the nurse practitioners to be back next year, and I think that will be an issue that we're going to continue to have to work on. If you're a physician and that scope of practice is important to you, which I know it is, that's an issue that will be back. I think balance billing is also going to be back next year. I know Ray Cruz, who is a colleague of mine from up here, brought one of the bills this year, and I fully expect him to bring it again. It's an issue that is personal to him. So I know he's continuing to work on that. So that's something that the Medical Society obviously has an interest in, and I know Mariah is continuing to lead on those conversations. Y'all are very lucky in having a Vice President of Governmental Affairs that is active, engaged, and at the Capitol all the time. But Mariah, seriously, you're always available and very knowledgeable about the issues facing the society and physicians throughout our state, and we are very grateful. As Senator Mills spoke about earlier, we have lots of bills that come up. I think there were 1,300 and something bills this year that came up, and that was in a year with 8 weeks off. So we have a lot of bills, and certainly the bills that come before the committees that we are on, we pay very close attention to. I'm on Health and Welfare in the House, so I read all the legislation that comes through there. So I'm pretty attuned to it, but I always have questions, and Mariah is one of my go-to folks that I want to bounce issues off of. My father obviously is Steen Trawick, who is a physician, is also with one of the healthcare systems up here, is another person that I speak with regularly, as well as several other doctors that have varying expertise in different fields. So I think that having that, medicine's so interesting because you have physicians that are employed with hospitals, you have physicians that are employed with LSU, with our with our educational aspect, and then we have private physicians as well. So it's balancing those three things as well. Learning about that area is important to me, and trying to find experts in each one of those fields is very important, so that we have a good expectation of what physicians throughout our state need and want in order to serve the people of our great state, which you do so well.
Thank you very much for that.
Thank you.
Y'all had a lot of issues with us this year. This is going to be, I think you're right, a lot of stuff is coming back.
Hello?
Oh, there we are. We seem to have
Oh, hey.
There you are.
I'm sorry, but I definitely want to thank you guys for having us today. And I don't know if I'm piggybacking off Lacombe, because as long as you don't run in District 67, I don't mind any doctors being in the legislature with me. But now you guys do a great job of informing and giving us the information. I can speak for myself, sending the text messages on different bills and things that that you want us to look at. So I definitely appreciate that. And you said it earlier. My wife's a physician here in Baton Rouge, Louisiana, and I have to go home. So hey, happy wife, happy life. So y'all have it made in the shade with me.
It was just unfortunate that you had to get so many emails too. Did I see Dr. Kendra walk by a little while ago?
Yeah. She walked by. Yeah, she's here. We're actually doing this, the virtual school, and we have homework, and so I have two little ones, a 5-year-old and a 7-year-old. So we're trying to, balance everything out here at the house. So it's cool.
I'm grateful that I'm homeschooling a high schooler, not a young schooler, because I don't know how parents with young children right now are doing this. I think one of the questions that I wanted to ask y'all, and we've got some that are coming through, but what did you expect versus what did you get? I mean, this was I've been doing this for more years than we're going to count, because that would definitely give you my age. I've never seen anything like this in a number of different respects. Not just the COVID, but y'all banded together as a group of new legislators more than anyone I've ever seen. Was that part of the dynamics of that you just got thrown into this very weird sort of experience, or do you just all really like each other that much? I mean, y'all seem to have coalesced and you want to make a difference. And so that's new for a lot of us too.
Mara, I'll start, because I feel like, as a freshman, I feel like a lot of us sort of bonded in December when we went up for our orientation and we were trying to learn the ropes. And many of us are coming from different districts and different, parties and different, we represent different areas of the state. But I think the common theme is that we really want to stop seeing Louisiana be 50th and everything. You hear all of us say that. And so I think there is a commonality of this freshman class. There's so many of us that really are working towards that goal of seeing us rise up in all the different areas where we're the last, which we shouldn't be the last, because we have great people in the state. That's kind of my short answer to it. I don't know, one of the guys may have something else to add.
Yeah, I completely agree with Amy. I think we certainly bonded over, the desire for us to help move the state forward. Being last or next to last in just about everything is very frustrating. And 40% of us in the House this year are new. I think we all ran on moving Louisiana forward. I know that was a main talking point that I had over the year prior to getting into office, and certainly one that I continue to talk about. But going back to, how we bonded, I think, so much of Baton Rouge was closed down. So much of the lobbyists were kind of stayed away from the Capitol, and people stayed away from the Capitol. So we had the opportunity to have, coffee together, to have dinner together, to get to know each other without the legislative side of it. And so we got to know each other more on a personal level and a family level. And I think that certainly has helped build the relationships. And I hope that will stick with us, certainly for the 4 years that we're in office for this term, and really hopefully moving forward. I hope to see that for our politics moving forward as a state, because I think we have to have that, and we have to have those relationships in order to build a stronger Louisiana.
and I will kind of jump in because it's the newish. Everyone else on the panel was elected in December, but I got elected last year, so I actually had a term to fill out. So I filled out the prior legislator's term, and in doing so, I got to serve a legislative session last year. So the differences of what to expect between this. So last year I came in 3 days before the legislative session started is when I got elected. We came right into the session, and it felt like a whole different world. So last year we had a budget surplus, and we had money, and we had the main topic of the concern was, mostly education and teachers' pay raises, and everybody was all optimistic and jovial and, hey, we got money, and we finally, after a decade, we could start putting resources here and recommitting things. And then we started this legislative session, and then the whole entire bottom fell out. So for the newer guys like Thomas and Amy and Larry and Bob, and who hadn't been there at all, they don't have sort of the experience of all the optimism. They got all of the, hey guys, we're in a worldwide pandemic, and congratulations, we had $500 million surplus. Well, that's gone. We don't have any money anymore. How are we going to do this? And so the sort of bonding that they did was sort of, I attuned it to sort of soldiers in the foxhole. They just walked right into a disaster. And, it wasn't that many people, so it's kind of funny. I said that I got elected last year. I served all of one session, and I am now more senior than 50% of the body. So, there's a lot of inexperience in the body, just don't really know how things started off. But these guys that came in right after me, and I'm still part of their freshman class. They call me newer, but we still technically freshmen. They were amazing in picking up and grappling the budget process and the budgetary process, and figuring out what all is the complicated scheme of what I call the sausage making. Nobody really wants to see how the sausage is made. They just want to see the end result. But these guys on this section, and all of these guys are here as panelists, and especially the others, they were amazing in picking up. I felt a little bit more privileged than them because I got to do it last session when there was only like 8 new people at one time, 8 or 9 of us. So we just kind of sat in the back, kept our mouth shut, and went with it. But we didn't have that ability to do that this session. These newer people had to get right into the fire and get going. They did a wonderful job at doing that. And it helped having Maria and some of the lobbyists who were sort of experienced in these issues to come in and also be able to tell us and walk us through, hey, this is what we've done in the past, this is how we've done things. So, I know that regardless of party, the panelists here, we all have sort of experiences from our personal lives that we could bring to the table, but they've done a wonderful job of getting in there, learning what they needed to learn under some intense fire. And yes, we're not done. We know that in October, we got to come back, and we probably going to have a budget issue. We're going to have some budgetary issues and crisis to deal with. And, for people who are experienced in the process of the budget, I sit on Ways and Means, I'm not on Health and Welfare. How we can do things in the state is, well, if you have a budget deficit and you got to make cuts, well, where are the cuts are going to come? The cuts are going to be in usually healthcare and education. Well, how in the world can we make cuts to healthcare in the middle of a pandemic when we need to be providing more resources to doctors, more resources to hospitals and to those things? So we're going to have a hard, huge, monumental task going forward. And I think that I like, and I'm optimistic that the people we got there can rise to the challenge to meet these needs.
Larry, Bob, either one of you want to add on to that?
I can kind of I think Bob kind of touched on it earlier when he was saying like the original session, how it was a little difficult, but the special session was for me, it was a little better. I felt like that it was kind of the bipartisanship kind of worked more, together more in the special session, because we kind of crunch time, we had to do it, and I felt comfortable. I felt like party lines. The freshmen made it easier because, the relationships that we did, we were able to have, and we could we're in the trenches together. We're in the trenches together. We all went through something, dealing with our colleagues' death, that kind of thing will bring you together. I have one of my teammate actually was out for a while and barely, almost didn't come back because of the COVID, related things. And so I was able to lean on Thomas. He sits across the aisle. And so when I had different issues, I was able to, ask him what's going on and things that I didn't know, that wasn't my expertise. I can lean on Jeremy, I can lean on Bob. And so for me, I didn't go in knowing everything. I went in wanting to learn, wanting to work with everybody, just trying to figure out where can we bring, bring Louisiana forward and work together. So it was a good experience in that special session. I think really helped us because, being out for 8 weeks, that'll do it to you, and it was draining. It was a lot of, a lot of work for my family, being away. And because I actually got COVID. And so it was a very interesting story and what happened to us. So it was good. I appreciate it.
I just think I really honestly think it's really just it's not just that the situation put us all together and we have such a good group. I think we actually just have a really good group of people. I honestly do. I mean, everybody is that we talk to for the most part is really honestly here for the right reasons, and they really want to make Louisiana a better place. And they're nice people. Most everybody that we're that's here and is trying to make a difference are good, honest people, and they're doing it for the right reasons. And I really think that's the bottom line, and that's why it's working. And I think as long as everybody keeps to their morals and they keep on the right path, I think we're gonna do some great things. I'm really excited about the next 3 years. It's gonna be fun. I think we're gonna do some really good things for the state. So looking forward to it.
Y'all are a very refreshing group of legislators to work with, and I have very much enjoyed it.
I would like to add, Mariah, I would like to add, because I was just thinking about this while some of the guys were talking, is that I give a lot of credit to our speaker and some of those in leadership and chairmanship positions, and how they, that's a smaller group, the third termers. They've mentored us pretty well. And they have done some things. Even our speaker has been traveling around the state to meet with small groups of us. And he was here in New Orleans yesterday and took a group of us to lunch. And he, last night, went with the group to Jefferson, delegation. And one of the things he said was that when he was in his first and second term, no speaker did that. And he really felt like it was really important that he travels the state and talks to us all as groups, just to know what we're thinking about, what's happening in our regions or what's happening in our groups. And so while it has been great that we have all had a strong, bond as a group, as freshmen, I give some credit to our speaker and those chairmen who are, Larry Bagley and Ted James and different chairs of the committees who've really taken the time to nurture some of us. And like Larry helped me very much with the bill I was trying to get through, and he co-sponsored it with me. I barely knew Larry Bagley. And so we worked together on this bill. We ended up having to pull it. It was a long story, but I had his guidance in that process. So we have a good group of leaders helping us they want to see us be successful. Even though I may not be in the same party as the speaker, if I go to him with something, he's like, well, let me give you some advice about that. So I think that's been really good for this session for us.
Like that a lot. My first several years as a lobbyist, it didn't matter what party anyone was. That was before you did the whole closed primary system, and you could just be yourself. It didn't really matter what party it was. And I feel like y'all are kind of getting back to that camaraderie of let's just make a difference. So that's nice to see.
And I'll add to what Amy said about that. That's one of the things about the newer group here. When I came in last March, we already had a speaker. We already had committee people. We already had everybody established. And so they pretty much was like, here, Major left, and we're going to give you one of Major's good committees, but we're going to give you this other committee over here that you know nothing about. We need you to serve there. But they already had leadership. They already had all that in place. And then so we didn't have that very contentious, I didn't have that experience of a very contentious speaker internal race. And then but all these guys in this panel came in, we had a very contentious speaker race where a lot of outside influence, political influence around the state were coming and getting involved sort of in the rail of our internal politics. And it was a very interesting dynamic of how the 40 new people kind of got together in the selection of that deal. And I can tell you, I know that I didn't wish that on a lot of other people because I thought it was sort of, to some extent, unfair to some of the newer people who didn't know any of these people, who had never met a single one of the people that was in leadership or trying to get there. And then they had sort of these outside influences that were just calling them, you need to do this, you need to do this. But I think a lot of them stood up and said, you know what, we're going to work this out internally. And, you know, it's been sort of kosher because I am like Amy. I believe that our leaders, we have a good speaker in our leadership. We have good committee chairs across the board. And I know a lot of the people here that were new panelists, you know, they got through that. It was their baptism by fire, so to speak. Once we got through that speaker's race, then you saw sort of all the dominoes falling, and it really, they did hit it. The special session, we knew we had to make these things happen then, and it gave a lot of people. While I'm a Democrat, I'm what I consider a very moderate, middle of the road person, and so I don't just go dictated by party lines. I always sort of follow what I want to do first. And as we were going through that in the special session, we got away from the real hard bipartisan issues. I mean, partisan issues. I think most of the people started coming together and saying, wait, we got to get this done. We got to get a budget. We got to get X. We got to get these things. So I saw it sort of transverse into that, which is a good thing.
I know that we are kind of reaching our time limit for what we had published, but what I'd really like to do in the coming weeks is maybe get each of you on an individual Zoom call with me and just record it and keep going and get some additional thoughts, talk to you a little bit about what you think might happen in the special session, and just sort of continue the conversation. If y'all don't mind my just, you know, plugging in and tracking you down to do that, that'd be great. Y'all can be my first sort of YouTube video Zoom world collection.
Sounds great.
Happy to do it. Yeah.
Great. Well, we thank you for your time. I look forward
y'all
to
for being with
continuing
us.
to work with y'all.
Thank you.
Thank you. I appreciate y'all, and anything you need, just give me a call.
I will do it, and we're going to share some slides. If you're welcome to stick around and watch what we're going to show in a few minutes. Larry, some of this actually may be interesting to you because we're going to probably talk about a little mental health sort of stuff in a few minutes too. So
Yeah, I'll be here.
cool.
All right, thank you.
So now I have to figure out how to move to the next part of this. I think that for most of you, you have received via email or through any number of ways our full legislative report. Looks like this. If you've not gotten a copy of it, you can get the whole thing. It's, I think, 8 pages, but it is on our website, which is lsms.org. If you hover over the advocacy line at the top, it's the first thing. It says 2020 legislative wrap up. I think probably then rather than Dr. Broussard and I sitting here and going through it piece by piece, you can read it and we'll save you some time, and we will jump into some information that came back through our survey and talk about some looking forward information related both to special session and issues, a lot of which the legislative panel brought up in the way of prior authorizations, prize billing, scope of practice. All of those things will continue to come back. I think I have to share my screen in order to do this. So bear with me, Dr. Broussard. Feel free to say stuff while I do this.
Yeah, happy to. So I mean, I think, you know, to the extent that balance billing comes up again, especially if it comes up in this special session, there's a few things that I want our physician members for sure to understand, which is, one is that, you know, some of this problem is actually confusion around the new high deductible plans. And so a fair number of times when I've heard sort of grumblings about balance billing, when I investigated into the details, in fact, it was not a balance bill. It was a simple high deductible appropriate bill that they had signed up for. And, you know, look, that can be quite a bit of sticker shock. I've been through that myself. And some folks get frustrated and they think that it's a balance bill, and they go sort of very upsetted to their representatives. And so the sense of the momentum of this problem is not in line with the actual scope of the problem. The actual number of bills that result in balance bills, it's way less than 1% of bills. So it's a relatively small problem. And of course, those that are being confused as balance bills but are actually just high deductible bills are not going to go away even when this problem gets, you know, quote unquote solved, so to speak. The second thing that I think it's important that our physician members understand about this issue is that, you know, some of the solutions that have worked in other states are not appropriate in Louisiana based on us having not fixed what's called assignment of benefits. So in Louisiana, when an out-of-network bill happens, the insurance company can send the payment to the patient. And sometimes the patient gets that money and they're confused by it. They think it's some kind of refund. They spend it on something else. And then when they get the appropriate bill from the physician, they don't even have the money that they were supposed to have from their insurance company to pay it anymore. And so one of our big efforts has been to fix assignment of benefits. One of the instruments that was available this past session was to accomplish that. And so we think that's why some of our opposition was against that particular piece of legislation. But we do favor the, you know, the slang term people use is the baseball style arbitration process, whereby there's a dispute resolution process set up, and they could pick between either the physician's bill or the insurance offer of out-of-network payment. I think that process encourages both parties to be reasonable about, you know, the bill and the payment being offered, because they know that if it goes to dispute resolution, one or the other is going to get picked. And it's also sort of a loser pay system where whoever's payment or bill doesn't get picked has to pay for the process. And so we favor that type of legislation and hope that it would present itself again in some way, you know, point along the road here. But it's a very complex issue, and appreciate all of the engagement of our physician members around that topic.
All right, I did manage to get it pulled up. Excuse me. So what we wanted to share with you was some information that came out in a recent survey that was really conducted by us, but we did it in collaboration with the BME and asking them to be the ones who distributed the request for the information. As so many of you probably got it through the BME. I'm hopeful that many of you took it. We did not personally push it because we did not want anyone to feel like we were weighting it in any direction. And there's a lot of information that we're still kind of culling through. But just to give you some basics, and I wanted to talk specifically to two things, and that was telemedicine and some mental health information. The demographics of the individuals who took the survey are before you. It's really remarkable that we had 1,037 physicians in the state of Louisiana take the time to give us their feedback. It was roughly a 20-minute survey. If you took the whole thing, there were 50 questions on it. What you're seeing before you is a breakdown of male to female and age grades. The practice setting and the practice status were both requested information, whether you're employed by a hospital, a group, solo, private practice, or retired. When you got to retired, there were a couple of different options. If you selected the option that you were fully retired and no longer practicing, that is where the survey ended for you. But we felt like any of the other retirees who are continuing to either practice as volunteers or to work during the pandemic needed to be included in the information. So overall patient volume being back to where it was pre-COVID level, not quite 50% of those. So we still have some work to do there. I think that falls in line with the information related to patients still being afraid to go to visit a physician. Percentage of practice that was being done via telemedicine before, during, and after COVID, you will see the red line. Practically no one was doing telemedicine prior to COVID hitting. And the flip-flop that you've got going on, we know our peak was during the COVID days. Post-COVID, we are still seeing a number of people that are working through telemedicine. The parity in payment is a big deal. As Senator Mills was discussing, we need to work on some of those things. We managed and worked very hard, both through the Department of Health as well as pushing AMA to do some things on a federal level, but we pushed very hard to have payments for telemedicine be the same as an in-person visit during COVID, in particular because those of you who could not practice medicine were shut down, and that was important to us. We will continue to push for that. We don't know where it will go. We have it for Medicaid and Medicare. The ERISA plans on a federal level did not follow through at the same level. Telemedicine implementation of future. This was just a breakdown of how people selected their telemedicine provider, whether it was with an existing EHR system, which seems to be the majority of people. We will go through the line item that was other, because that was a fill in the blank, and we'll get you more information on that. For the most part, as it stands today, since you're not 100% telemedicine, people believe it's working. It may not be perfect. There are just a few people who are interested in looking for a new provider and plan to switch. I think this is the slide that probably means the most to moving forward with telemedicine, and that's that as long as insurance will pay for it, you will continue to offer it. There are some specialties who came across through the survey that were absolutely adamantly opposed to telemedicine. They need the ability to listen to heartbeats and hear how you're breathing, all that kind of good stuff. And that certainly does mean something to a large number of specialties. This is the slide that we were talking about that gave a number of us concern. One of the questions that we asked was, how are you feeling through this? You will see that there are a large number of people who are discussing burnout, fatigue, stress. We had some come back with having feelings of thoughts of suicide and an increased drug and alcohol consumption. This gives us pause because we are always worried about our physician members and anyone in the healthcare community. It does also go in line with some of the phone calls that we've taken in our office of physicians who are asking how to completely close their offices. We have a practitioner shortage in the state of Louisiana as it is. We don't need this to be what takes us to the next level of needing to go out and find additional physicians. So this one was very troubling for us. We're going to have conversations with the Department of Health and others. We have provided the information to the BME that we all need to work towards developing some sort of program that addresses some of the mental health needs of our physicians, because keep in mind that this is 1,000 physicians in the state of Louisiana, and I believe this is probably a fairly accurate snapshot of what any particular segment of our society is experiencing right now, even if it's just as a parent trying to figure out how to homeschool. You've got all of these external factors. That's the end of those particular slides. Before we talk about some of the new things that we're bringing online with LSMS, I wanted to see if Dr. Williams had some thoughts that she wanted to share. I know we've all been talking about what's going on with hurricane impacted areas and how we can best help those individuals. Dr. Williams, did you want to do any sort of, and wait, we might have to unmute you.
Can you hear me?
There you
All
are.
right, great. Yes, I want to thank Dr. Guidry and Senator Mills, Representative Bagley, and all of our panelists for their participation tonight. And Dr. Guidry, particularly in his willingness to work with us. For the members, he actually entertained a conference call with me during the beginning of the pandemic to help us facilitate opening up the healthcare services in our state, and also has done conference calls with our leadership team to get our input in how to move forward. So I greatly appreciate the administration's efforts, and also look very forward to working with our senators and our legislators in the upcoming and our next session. I hope to accomplish great things. With that said, I do want to say that, you know, not only as an organization have we adapted to this pandemic, but we've also we've learned a lot, and that we are working hard to adapt to the needs of our membership and how to better represent our membership. We are working hard to streamline the process, to bring positive ideas forward, to implement them in advancing our healthcare needs for the state, and also in better representing our members in whether it's on our board level or committees. So I look forward to continuing my term and welcome phone calls, ideas. My email, my phone number is available so that we can all, again, continue to work together to strive for a better future. And thank you, Mariah. Great job tonight. So I'll hand it back over to you.
Thank you. And I do feel like we're rushing through. I know that we promised y'all we would do our best to be off by 7:30. So I am rushing through some of this, but I want to give y'all the ability to, and I'm going to share one more screen while I talk about those who've been impacted by the hurricanes. Maybe if I can get it to work, because I seem to be struggling right now. There we go. It's coming back at you, Sarah. All right, so we as a staff have been having conversations. Right now, we have got so much going on in the areas of the state that have been impacted by Hurricane Laura. We are still working hard to assess the needs of those physicians that have been impacted. We know that a number of physician offices, in fact, probably the majority of those in the Calcasieu Parish and the surrounding parishes, are currently not able to open. We've understand that there are a large number of those offices that have sustained significant damage. We are trying to build a database of if you have gently used equipment that you might be able to donate at some point. We would like to hear from you. If you have other thoughts on things that we can do, and if you are in contact with physicians in those areas that have been impacted, please make an effort to let us know how they're doing. Right now, just communicating with so many of them is difficult, between no electricity, no internet, etc. We're relying on those that we manage to get through to give us as much information as possible. But it is critical. Just if you just think about the last slide I showed you on mental health, you're dealing with COVID, and now you're dealing with a hurricane on top of that. It's critical that you touch base with your peers and friends. Let us know how people are doing and what they need and how we can be helpful. We've got the slide up there with Terry's name on it for you to be able to send her emails if you have anything that you might be able to provide in the way of assistance to those physicians that have been impacted. Please send her an email. Let her know what you might be able to do in the future. And if we manage to put together a list of items that might be useful to those physicians in those sections of the state, we will get that out and do our best to collect as much of the gently used equipment. In fact, if there are those of you out there who might be considering upgrading equipment, this might be a beautiful time to do it, and offer what you don't need anymore to the physicians in that area of the state. With that, I do want to also share with y'all that we've got some new things coming up within the LSMS. You'll be getting some additional information on the MEP 401k, where we have partnered with ACG Wealth and Blue Star Retirement. It's a multi-employer 401k plan, which allows physician practices to take advantage of efficiencies and cost savings associated with that type of plan, but still have the ability to customize the terms of the plan to your specific business. We've been getting a lot of phone calls on this in recent days, and I have Jeff here. He can pop in and give information if any of you have specific questions tonight. We are also working on a group purchasing organization, a GPO, where we've partnered with Live Oak Purchasing to save physicians money on everything from office supplies to vaccines to health insurance and much more. We're looking into a number of different things that should really be able to help you as business people do some new and innovative things for yourself and your employees. Jeff, you're back there behind the screen. Did you have anything you wish to add to what I just said before we close? Shaking my head no. Okay, Jeff says no, so apparently I did that okay. I just want to say thank you to everyone who has participated with us throughout this past year. You've been great members to work with. I am sorry that the 2020 has been what it is, but I look forward to seeing y'all in person. We'll be sending out some surveys with some questions about this. Go gently on those of us who've had to figure out technology and make bits and pieces come together. Oh, yes, Jeff just held up a sign to me to remind me to tell y'all that we recorded this, and please share with your colleagues that it will be posted. When it becomes available, we will send out the information in the QW that it's out there with a link on how you can view it. I won't be watching it again because I tend to think I sound funny when I look at myself, but thank you for your time. And thank you for being members of the society. We appreciate you, and we look forward to continuing to serve the physician community. Y'all stay safe, be well, and good night.